Inflammation is the effects of exercise on inflammatory biomarkers are widely being evaluated in preclinical and clinical studies. Serum interleukin levels are upregulated following physical exercise by the duration and intensity of exercise. Moderate level physical exercise has been shown to result in a 16-fold increase in interleukin mRNA level in human skeletal muscle cells and a 30-fold increase in serum interleukin levels, while such change might be attenuated by antioxidant agents including vitamin C and E. Moreover, elderly individuals show an amplified interleukin release in response to exercise, even though has a wide range of pro-inflammatory activity in the immune system, including the activation of humoral and cellular immunity cells and secretion of acute phase reactants, including C-reactive protein (CRP). Interleukin also has considerable anti-inflammatory properties. The monocytes macrophage-derived interleukin, in response to the nuclear factor kappa B signaling pathway, has a wide range of pro-inflammatory roles in human wild muscle contraction-derived interleukin. In response to the calcium nuclear factor of activated T cells and glycogen P33 and mitogen activated protein kinase pathways has anti-inflammatory roles. Such anti-inflammatory properties and physical exercise have been validated in a model of low-grade inflammation in which the immune response is healthy subjects to the administration of low doses of Escherichia coli endotoxin is evaluated.
Energy exercise during exercise, carbohydrates during intense short duration physical activity. So carbohydrates, mainly glucose, are the primary energy sources. Lipids in the prolonged or low to moderate intensity exercise, lipids become the main energy sources. Trained individuals use lipids more efficiently compared to untrained ones. Exercise effects on lipid profile. So exercise as anti-genetic effects, mainly in the health prevent plaque buildup in the arteries. Exercise 32 or 5 days a week for order 6 months, and the improved to the ratio of the HDL good cholesterol to LDL bad cholesterol, and reduce triglycerides and LDL levels. These benefits are the seen in the both healthy individuals and the patients with conduction lacks, isometric heart disease, diabetes, or chronic kidney disease, chronic kidney disease, and the sarcopenia. Chronic kidney disease is associated with a premature again muscle wasting and system inflammation. As kidney function deteriorated, sarcopenia becomes more common and is likely to increase mobility and mortality. Exercise effect on sarcopenia. Uh, so I studied on notes dialysis cerca de patients showed that those 22 moments of the straining and the balance targeting significant increments the muscle mass and reduce total body fat in both groups. Additionality, mutant levels increments during the study, both the relationship bedweb, mucin, and muscle mass weakened over time, suggesting that exercise can counter, counteract muscle loss. In conclusion, regular moderate exercise, particularly focus on resistance and balance, can effectively present the muscle mass, prevent sarcopenia.
Physical exercise impacting with chronic insight design. In the article, they discussed in detail two reasonably large trials that produced results of particular clinical relevance due to the age population with its overweight patients and they analyzed the recent results. The first trials, which included 111 patients with chronic kidney disease, that physical therapy alone is combination with caloric restriction is associated with the disease in body weight and body adipose tissue and reduction in circulation levels of biomarkers of inflammation, antioxidant stressors and serum levels. Patients were randomized to caloric restriction and aerobic exercise. Caloric restriction alone, aerobic exercise alone, or usual care the combined group, and statistically significant reduction in body weight and fat percentage comparative to the usual care group. Furthermore, caloric restriction also led to this significant drop. However, these are not seen in the exercise group.
Physical exercise is associated with oxidative stress student since 1978. This phenomenon occurs due release of reactive oxygenate species rounds such as superoxide and anhydride radical generate mainly in the mitochondria of contracting muscle fibers. These rows are involved in processes such as muscle fatigue, cellular damage, intercellular signaling, and adaptive response of the organism. Rows production can lead to lipid peroxidation detectable by biomarkers such as pentanes, book irreversible, while antioxidants such as vitamin A. However, the body develops adaptive mechanisms to oxidate stress to regular exercise, including positive regulation of antioxidant pathways increase in the protective enzymes such as superoxide dismutase 2, essential for cardioprotection, negative regulation of peroxide pathways, reduction of enzymes such as citrate synthase and malate dehydrogenase, tissue repair and adhesion, stimulates regeneration and hypertrophy or hyperplasia, depending on the affected tissue in the long term. Physical training improves the body's antioxidant capacity in skeletal and cardiac muscle, minimizing cellular damage caused by rust and engages cardiovascular and metabolic benefits. Atom exercise generates oxidative stress continue training activities counter-regular or mechanisms that protect the body and optimize its response to effort.
My name is Diana. Explain to you the context of the video that you will see next in its video. We will be able to see the difference between its own we are going to show you on where we set times we say times they have greater opportunities time turn higher socioeconomic resources and we are going to show you one of the videos where we are going to see how a state hospital where it has fewer resources less opportunities and so on. We are going to explain to you in the upper part this video what it shows are the technological advances permanent accompaniment of nursing specialists of medicine of untimely infrastructures BT, BT advanced technology and other process than we can evidence with times its way we have let's say that's through higher socioeconomic level and we can quote and pilot sign time a better service so to speak clearly it's close no be but we are going to set let's say it in per part and video where we show what are the patients with the lowest resources and how it is infrastructure of the hospital and the rooms are different and stand are patients of on the floor as three are patients who don't know what the opportunity for a quick diagnostic unfortunately because they do not have the opportunity or access to health service. We are also go to talk about to rural areas with the hospitals are too far away and three are many people who can't get the opportunity to to receive care. So in our work, we explain for the activity on the inequality in states' rural territories. Not only in the city, but also in rural areas where the hospitals are too far at one and share are many people who can't have the opportunity to receive care. Not only Goat City, not only South Bogota and the 11th of Colombia book also around the world. Its health inequalities are presented worldwide. We will realize that if we style that if it's not only affected the person to the patient but also to health personnel in the video belong with relatives thanks to staff also. Healthcare providers also have some difficulties to provide a decent health service, and even many of state's personnel have been affected not only towards theoretical with being but also towards psychological state. I hope that with the video we can understand that it is not only a affectation of a Colombian living book, also at global level.
Good. And as a last, in the current medical are where the pharmacology perspective of distance is the major focus with sufficient emphasis of lifestyle intervention, the potential of physical exercise to enhance the life of CKD patients is significant, and this has allowed exercise to become an important component in the management of this patient's population. Reduce in inflammation, body weight, and fasting glucose level, along with improving functional capacity and quality of life, have been now shown as the major beneficial effects of scourge in patients with kidney disease. However, the role of exercise in kidney function is unclear in the context the hemodialysis, peritoneal dialysis, and kidney transplant patients. The potential benefits of exercise surge in decreased cardiorespiratory fitness, walking capacity, and possibly reduce arterial stiffness. Are Matthew B. Marquez Rayman includes there is a clear need for compressed long-term trials with large sinks to definitively determine the safe and here's feasibility and impact of exercise on the quality of life and crucial clinical outcomes such as mortality. The risks of cardiovascular events as well as graft health and the incidence of malignancies and infections in kidney transplants recipients.